Let me just start with healthcare, because that is a huge, huge issue in Washington, D.C. right now. What are we going to do? How are we going to protect people's choice? How are we going to protect, foster competition? How are we going to lower costs in healthcare? How are we going to really support those kinds of approaches, as you mentioned, that's going to result in better care, better outcomes for us at lower costs, retaining choice, providing competition to the private sector. We know that we cannot sustain this healthcare system the way it is. It is going out of control. It represents 1/6 of our economy. 1/6 of our economy goes to healthcare costs in this country. The outcomes are not very good compared to all the money we spend on healthcare. It represents 18% of our GDP. And is going up. Right now, our healthcare system pays for quantity over quality. So it's usage. The more you use something, that you just get reimbursed for that, unless your insurance company basically is denying that particular kind of coverage. But it's very clear that our system pays for quantity, not quality. So we need to shift to quality outcomes, and having a system that will elicit the kind of information we need to make those kinds of shifts. I am a supporter of the public option. I think it is important that we individuals have a choice as to what kind of plan we would want to be under. We have some 47 million people in our country who are totally uninsured. We are all paying for it, by the way. People don't recognize that our insurance premiums reflect the fact that all these people go to our emergency rooms where they have to take care of them, and that money, the cost of that care has to come from somewhere, and it comes from those of us who have health care. So that adds over $1,000 to each of our premiums. We can't sustain that. In my committee, there is an express exception for Hawaii's prepaid health care law. That generated some interesting discussion on the part of members of the committee, because they said, why should Hawaii be so special? What do you guys do? You know, there's very little understanding of the fact that Hawaii has had a prepaid health care law for 35 years, and that it is the first and only employer-mandated health care law in the entire country. We have all these people in Congress who keep talking about Massachusetts and other jurisdictions, but no state has gone the route that Hawaii has in providing health care for our people. So there is this exception, and it's just for the Hawaii's prepaid health care law. It does not exempt Hawaii, the state. There are parts of the bill, if there is a bill, that will impact other, those that are not covered under the Hawaii Prepaid Healthcare Act, and that would be all the part-time employers. And under the federal law, there probably will be an exception for small businesses. There is no exception for small businesses in Hawaii's prepaid healthcare law. And so I wanted to make sure that Hawaii would have an opportunity to make a determination and assessment of how our situation would be impacted by any kind of federal law. And if we didn't have an exception like that, we would wake up at the end of the day, if a healthcare bill emerges out of the House and the Senate, and saying, oh my gosh, the system that we've had in place for 35 years will be out the window. And I think that is not where we want to be as a state. So if you have any specific questions about elements of the bill, there's a lot more focus on the prevention side of things. There's a lot more support for primary care providers. There's a lot more emphasis on providing and support for community health services, because we think that prevention is a key to lowering costs. I think one of the major challenges for all of us, members of Congress, in dealing with this issue is all of the misinformation that is floating, and there is a concerted effort, as I said, with lots of money behind it, to create a confusion around this issue. So my purpose is to have those kinds of meetings that are really fruitful, as opposed to somebody just coming in and disrupting and yelling and doing all that. I want to get input that will be useful as we move forward on this bill. It was really, really important that the Ways and Means Committee figure out how we're going to raise basically $1 trillion, where we're going to get $1 trillion to pay for this bill. So if anybody says this is going to add another $1 trillion in debt, that they are dead wrong. This is a bill that is going to be paid for.
In behalf of the Japanese Chamber, thank you and your staff for spending time with us. I think it was very helpful. We will hopefully continue the dialogue, and
Yes.
now we've met the faces, so I think it'll be very helpful for all of us. So I want to thank all of you for being here, and how about a round of applause?
Thank you.